The situation this morning in the three most populated states is described as dire. California, Texas, and Florida, each marking record high average daily deaths this week. In hard-hit L.A. County, some on the front lines are demanding better staffing and more protection. Now, a medical association that represents nearly 200 medical schools in the U.S. and Canada is warning that without urgent action, the death toll could skyrocket well into the multiple hundreds of thousands. Among the group's proposals, increasing the availability and accessibility of testing and establishing a nationwide standard for face coverings. The group also recommends national criteria for K-12 school reopenings. Education Secretary Betsy DeVos says how schools reopen must be decided at the local level.
There's not a national superintendent, nor should there be. Therefore, there's not a national plan for reopening.
It comes as a new study is looking at long-term side effects of COVID-19. A survey of more than 1,500 so-called long haulers reveals dozens of symptoms that persist weeks or even months after patients recover, including fatigue, body aches, and difficulty concentrating.
I feel like I'm still in this kind of mental fog.
And as drug companies search for treatment options and work to develop a vaccine, Dr. Anthony Fauci is warning about a widely shared video, even shared by President Trump, in which doctors touted hydroxychloroquine, a drug the FDA has cautioned against using to treat the coronavirus.
The only recourse you have is to be very, very clear in presenting the scientific data that essentially contradicts that.
Meanwhile, another member of Congress has tested positive. Republican Louis Gohmert of Texas, often seen without a mask. Without basis, he blamed the facial coverings for his diagnosis.
When I have a mask on, I'm moving it to make it comfortable. And I can't help but wonder if that, puts some germs in the mask.
Mr. Gohmert says that he does not have any symptoms right now. Meanwhile, Speaker of the House, Nancy Pelosi, has now issued an order. Everybody in the House, including staff and members of Congress, now must wear a face covering. Hoda, back to you.
And Tom, Dr. Fauci spoke about something else. He also spoke about the importance of not only wearing the mask, but maybe even eye protection, like goggles or a shield.
Yeah, a lot of people have these. I have them with me all the time in case I'm in a specific environment in which maybe I need the eye protection, certainly on a plane or in an airport. Dr. Fauci addressed the effectiveness of goggles.
Theoretically, you should protect all the mucosal surfaces. So if you have goggles or an eye shield, you should use it. I mean, it's not universally recommended, but if you really want to be complete, you should probably use it if you can.
Yeah, to be clear, he's not talking about having it at the house or necessarily when you're out walking the dog, but rather when you're in an environment. Same thing with face shields. In an environment with a lot of people, it may be a good idea, but really those face shields are best for medical professionals, hospital workers, paramedics, and the like. Hoda?
All right, Tom Costello for us. Tom, thank you.